Okay, so welcome everybody to today's webinar. My name is Crystel Rynne. I'm Head of Product Marketing here at HRLocker. In today's webinar, I'll be talking about the return to work and how HRLocker can be used to deliver the correct procedures and protocols to facilitate the safe return of your employees to the workplace. I suppose before I start, please note that this webinar will be concentrating on the guidelines laid out in the Republic of Ireland. So I do see we have some people from the UK on the call, so I'll be referring to the back to work protocols that have been issued in ROI. So the procedures will still be the same, but just make sure that you're following your own guidelines as well, laid out by your own governing body. So in this webinar, we'll run through what you'll need to do before the return to work. So specifically, what I'll be concentrating on is the guidelines that have been laid out by the government in the back to work protocol. So the first things you'll need to be doing is going through your risk assessment, doing your COVID-19 response plan. You'll need to assign a COVID-19 officer. And I can't stress this enough, you need to make sure that you're actively engaging with your employees to be able to actually talk to anybody about their health concerns or what the return to work will look like for people, and explain how you can do that through HRLocker as well. For a lot of people who are in offices, you might have to start scheduling who's in and who's out of the office to make sure that you have that social distancing guidelines in place as well. We'll probably be spending a lot of time going through how to upload the relevant documentation in HRLocker. So as part of the risk assessments that you'll be going through, which I'll discuss with you in a minute, you will have to you have to produce a lot of policies and procedures around hygiene policies and social distancing policies and different guidelines that you will have that you'll be putting in place in the workplace. So I'll go through how you can actually upload these into the system to make sure that people have read them and signed them before coming into the office. There is, as part of the back to work, the return to work protocol, there is a COVID-19 form that all employees will need to fill out at least 3 days before they return to the workplace. So I'll show you the form and we can have a discussion around it, and I'll show you how to upload it and disperse it out to everybody. And some of this documentation, obviously, you'll be putting out per department or per office or per employee, and we can discuss how to actually do that as well in the system. The other areas that we'll look at briefly as well, if you've had people who have been on the COVID-19 payment for the last few months and haven't actually been working with you, I'll show you how to bring them back from the short-term leave status that they should be on at the moment. And then also, for some people, you may not be bringing them back on a full-time basis. You may be bringing them back on a part-time basis. So we'll discuss how to change their work pattern to a part-time work pattern. So we've got a lot to go through today. And I'm sure, much like us, everybody's had a lot of questions. So we do have an open Q&A, which you should be able to see on your screen. So I have Isabel with me today, and she's monitoring the Q&A section. So if you have any questions throughout the webinar, please throw them up there, and Isabel will send me on the questions. And at the end of the webinar, I'll answer as many questions as I can or point you in the right direction of who's the best person to contact in regards to answering those questions. Like I said, we will be going through a lot today. So if there's any area that you would like to get more clarification on, or if you'd like to maybe set up a call to, discuss them in more detail with either myself or Shane here in the office, please get in contact with us and we'll be delighted to go through it with you. And as always, this webinar will be recorded. So at the end of the webinar, we'll send you out a copy of the webinar as well as all the documents I'll be showing you here as well. So you can have copies of them. So I suppose the key really in regards to the return to work is that it's very important that people are following the back to work protocol. And we do have a copy of it here on the HRLocker website. But it's the government document, and it goes through basically the need to appoint a work representative. So everybody will need to appoint a COVID-19 officer, the preparation and training that's required. The first thing that you need to basically put in your COVID-19 response plan and make sure that you're communicating that with everybody. and develop or amend the policies and procedures. So that's very important when you're going to be returning to work. And as well as creating these policies and procedures, it's extremely important that you're communicating them to employees and explaining the reason why these policies and procedures have changed. So that's also an important aspect. So again, it's around the policies here. And so I would, really recommend that you just have a quick run through of the return to work protocol and minimizing the risk. So as part of the return to work, it's really important that you do a risk assessment before you, at this stage, if you guys are planning on opening up maybe the first week of September or whenever you're planning on opening your offices, that you're doing that risk assessment just to establish, I suppose, the different areas of the office that may need to be changed, or how the bathroom facilities are going to work, or if you've got 10 people in an office, how many people can you actually put into that office to ensure that you've got your social distancing guidelines in place. So it's really important that you're putting all those guidelines in place as well. As part of the back to work protocol as well, there is a form that all employees will need to fill out a minimum of 3 days in advance to return to work. Now, what I would be recommending, and I'll show you how to do this quite easily through HRLocker, is that if you're planning on returning to work in the next month or so, that you can have these discussions with your employees, send out these forms, get all this prepped first to make sure that that you're discussing with your employees if they do have any serious health issues or health concerns, and they may be in that shielding category, that you're aware of it, you've had a discussion with the employee, and you're putting the correct policies and procedures in place to help that employee. And so I would really stress for all these things is that the employee engagement is there constantly. And then, this is really the last part of the return to work protocol is really dealing with a suspected case of COVID-19 in the workplace. So we'll talk a little bit about how you can set up HRLocker to help you do your contact logs as well for people who will be in the office. And then the hygiene facilities as well. So it's really important in terms of actually having that correct signage up and things like that. Okay, so I'm just going to show you then how you can kind of really set this up in terms of using HRLocker to communicate these things to your employees. And the first thing that you're going to do is, I'm just going to show you this here. So this is your risk assessment. So again, all these documents we'll send all of these documents to you at the end of the webinar, but they can also be found on the HRLocker website. So it's very important that before returning to work, before you're opening up your offices, that you're doing a risk assessment. And all these risk assessments will probably force you to create some kind of policies and procedures. So specifically around, so we have here staff working together in a workplace. So obviously that's inevitably raises the risk of virus transmission. So home working reduces this. So what can we do actually in the workplace to facilitate this? So we'll send this out to you. Make sure that you fill out the risk assessment before you go, and then decide what kind of, do you need PPE? How many people can you actually fit into your office? Do you need to have screens, or can you just separate the desks? How many people do you need to be scheduling people at home every second week or every second day, or have you had that discussion with your employees of how actually returning to work is going to work for them? Do you have employees who are currently shielding and maybe want to continue shielding because they may have an underlying issue? How are you going to deal with this? Have you spoken to people? So it's very important that you have this communication issue and you have it set up. So once you have the risk assessment completed, unfortunately we can't do this, you have to do this each yourself. So once you have the risk assessment completed, you then need to start dealing with your policies and procedures. So the first place that we're going to start looking at here is the HR documents section. Okay, and this is where you're basically going to publish any of your updated procedures. And even if you're only going to be returning to work in September, I would strongly suggest that you are publishing all these documents now to employees. They should also have access to HRLocker so they can log in, sign all the documents, answer any questions that they may have. but you have all this prep work done prior to doing it, and it'll just kind of alleviate some of that headache for you. So you see here, so I have, there's the social distancing guidelines that I've published here, updated clock in and out policy, updated safety statements, safety and health plans. So, and all of these, once you publish them to individuals, they'll be prompted to digitally sign them once they read them. Okay, so I'll just show you how to actually go around publishing a document. So if you go into, so again, I'm in HR Docs section here, and there's essential, basically HR Docs is split into two different sections. There's the essential document here, which will require individuals to digitally sign the document. And the other section is basically, it's just, you can publish documents here, but they don't actually be required to be digitally signed. So the first thing you're going to do here is we are going to put up probably, let's put up the return to work protocol, okay? So we're going to call it, it could be updated hygiene hand washing policy, okay? So you can put in here a description in terms of, due to COVID-19, we have updated our hygiene policies. Okay. Now, I'm putting these all in individual documents. You can, if you want to do a full, maybe an updated COVID-19 policy document where you may have 4 or 5 different procedures and policies together. But for the sake of this presentation, I'm just doing them as individual documents. So for this updated hand washing policy, I have a decision now. Okay, does this document, does it apply to everybody in the entire office? Does it apply to specific departments, or does it apply to all user types, so that would be managers or employees, or just to specific employees? So this document here, really, this is going to apply to everybody. So I'm going to leave it that it's going to go to the entire company. And the key thing here is that I create it as an essential document. And this essential document basically will require a digital signature. So once I submit it, you'll see it's come up here. So this then will be accessible to everybody. Everybody in your system will have got an email saying that you've published a new document, and please go into HRLocker to read the document and to digitally sign it. So they'll come in here and they'll digitally sign it. Once they digitally sign it, have you read the essential document and are you ready to sign? Once you press sign, they've now signed the document. Okay. So you'll have basically a log then of who's actually signed all the policies and procedures. So that's important, is that any of your health and safety policies that you're looking in, you've done your risk assessment, and you've looked at your risk assessment and you've decided, okay, so which policies and procedures do I need to put in place to be able to facilitate the return to work? So, do we need to, are there certain access points or certain levels of people in different buildings, or where are our isolation rooms and things like that? All these things will need to be communicated to your employees. HR Docs gives you a really nice way to be able to just upload the documents here, publish them in just one click to however many people are in your company, and be able to get them to sign it, so you can constantly have that record as well. So the other thing that I would say is that, so now that you've got all your policies in place, you've decided, you've done your risk assessment, and you've decided now you actually want to bring people back to work. So this is where your communication element is going to come into place. So if you've had people on a number of months that they've been on the COVID-19 payment, they've been home for the last few months, or even if they've been remote working for the last few months, you need to now keep a record of the contact that you've had with people to call them back to work. Now that can also be done here through HR Docs. So once you've decided that perhaps maybe the 1st of September is when you're going to be bringing people back to work, you can publish a document directly to the individual. So say, for example, we're going to call this one, who am I in at the moment? Let's choose an employee. Oops, we'll choose an employee. So we'll choose one, we'll publish it to myself. Okay, so we'll call the document Crystel, Rynne, communication to return to work. Okay. And, so in the description, you can say, office is reopening on the, let's say the 1st of September. Okay, so whatever description you want to put in here. Okay, I'm going to choose a file. So you'll have a letter here ready to go that will be addressed to the employee to explain that you have put in all the correct policies and procedures, health and safety policies and procedures, you're following the government's return to work protocol, and that on the 1st of September, you are now going to be required to come back to the office. And please confirm that this is the date that you're happy to come back with. Okay, so because obviously this is a specific letter that's addressed to an individual employee. I obviously don't want to publish it to all these areas. I just want to publish it to an individual. So I'm just choosing myself. So this document will only go to this employee. It won't be visible to anybody else. So there's my, and it's my essential doc. So I want them to actually digitally sign this as well. So once I submit this to the individual, I'll just pick myself here. Okay, so you'll see that this document has been published to this employee. They've got an email saying, please return to, a document has been published to you in HRLocker, please come in here and digitally sign it. So you have that audit trail that you have actually communicated with them in regards to when the return to work would be in regards to opening the office. So at this stage, this is where I would highly recommend that you begin to engage with your employees, because HRLocker, yes, we can help you in regards to sending out documents to people, keeping that audit trail, but it's really up to yourselves and your managers to be actually actively communicating with your employees to say, if they cannot return on the 1st of September, what's the reason why they can't do it? Do they have an underlying health issue? Is there somebody in the house with an underlying health issue? Do they have issues around childcare, or what are the issues? So you make sure that you're able to have that conversation to be able to facilitate your employees back to work. Now, unfortunately, if you're coming across with if you're opening maybe in August and people are still continuing to have that COVID payment, and maybe they're getting more money on the COVID payment and they don't want to come back to work, and this is often asked from us, well, what do I do? So, the key thing to remember is that your policies and procedures that have been in place since your company has opened, your handbook is in place, all those kind of policies and procedures are in place, they still stay, they're still valid. So if you have informed somebody within a reasonable time, so you've given them 2 or 3 weeks notice that you will be reopening the office, and if they do not have an absolute legitimate excuse, well then unfortunately, they are in breach of their contract. So they do need to return to work at some stage. So unfortunately, nobody wants to get into those conversations. So if that is the case, you will need to go down some kind of disciplinary route if you can't save it at that stage. But for those individuals who, they may have an underlying health issue, or, if you're bringing people back in August and there isn't childcare facilities that are open, or one of their children may have an issue, I would strongly suggest at that stage that you're actually engaging with your employees to discuss, well, actually, how can we facilitate this? Maybe come back 2 or 3 days a week, or with a part-time solution, or can you continue to remote work? And that is still the government guidelines, is that where remote working can be done, that should be continued. So that is very important, is that if there is an issue, I would strongly recommend that you're having those discussions. But then the key as well is that you're actually recording all these discussions. And that's where HR docs will come into as well. So again, maybe I've had this discussion with this employee here. She's relayed to me that she has an underlying health issue. She will be continuing to shield, and we're happy for her to continue to remote work. So at this stage, I'm going to send another communication out to her. So I might say, call notes or something like that. So as discussed on the 14th of July or something like that. Okay. And I will upload here a copy of a letter that I'm going to be sending them to this individual, saying that we've spoken to her, we've requested you return to work to the office on the 1st of September. You've relayed to us that you do actually currently have an underlying health issue, and we cannot facilitate that, in regards to in the office, but we are very happy for you to continue to remote work. and we'll continue to put those supports in place for you. So it's very important that you have that constant communication, but that you're also documenting it and keeping an audit log of it. So you do the same thing here. So you'd put in the notes here, select the individual so it's against their file, and that it's an essential document. So both the employee and yourself have both signed that, yes, this is exactly what has been agreed. So and even then for that individual who said, well, you know what, I can't really come back on that date, I prefer to go on another date, you need to have that constant discussion with them and to record everything that's going on here as well. Okay, so now that we've done, we'll just recap. So now that we've done our risk assessment, we're following that back to work protocol. We've done all our policies and procedures. So there could be new hygiene standards, whatever else. You've communicated to all your employees that the office will be reopening and you expect them to return to work on whatever date it is. And you've put in all your guidelines. Everybody's signed everything. Everything's great. The next things that you need to be doing at this stage is that you have got to appoint somebody as a COVID-19 officer, and that's very important. So this can be done and as well, it can be done in HRLocker in terms of their job title and their roles and things like that. But it is also important that there is training that is required with the COVID-19 officer appointment. So make sure that you have chosen somebody who you think is going to have an active role in it, and that it's not just a tick the box exercise. You've chosen somebody and you're happy that they're going to continue to be the COVID-19 officer. So I'm going to pick on myself again here as well. Okay, so in this regard, I'm going to put in a job title here. Okay, so and COVID-19 officer. Okay, so it's not a promotion, okay, but the description will be HR and COVID-19 officer role. When was it effective from? So we're going to say it was effective from the 1st of July. Okay, and notes. So as discussed, Crystel will be taking over the COVID-19 officer role. Okay. Yeah, and you'll see there that new role has been assigned to me here, and it's been recorded here as well when that was active from. So again, if ever you're audited or you need to actually show, well, who's your COVID-19 officer, you can just go in here and show them when that actually occurred. So that's that section in terms of having your COVID-19 officer. Now I'm going to show you, so we've done our HR docs. I'm going to show you the next section here, which is the CPD section. Okay, so the CPD section basically is any training records that you need to record for anybody. So there is a lot of training that will be required when you reopen in the office. So a lot of it can be online training. Ideally, you'd want everybody to do the online training before they return to work, and they can just come into CPD, into HRLocker then, and just upload the certs that they've gotten, and that you are happy that they've done the training and that they're happy that they're ready to come back to work. So a couple of things that we're going to assign here. Okay, so the first training that we're going to do is always in the Manage CPD section here. So basically, this is all the training that I do in my company. So we're going to create a COVID-19 officer training. Okay. Okay, and then in the description, what I would certainly say is put in the link to where the training is going to be. So whatever training provider that you're using or software. So is it certified? Yes. And you can upload a course documentation. So if you do have a document in regards to what the actual course is going to entail, you can upload it here as well, but it's not a requirement. Okay, so we're going to submit. And now, so you see this training has been created here, and now I need to assign it, and I'm going to assign it to my COVID-19 officer, which is myself here. So I'm going to assign it. It's mandatory, and I want this person to have it completed by Thursday. Okay. Now, so that individual, we'll see here now, it's been assigned to them. That individual is going to get an email notification to say that their COVID-19 officer training has been assigned to them. They need to come into HRLocker and once it's completed, to upload the records that they've done it. So I'll just show you here now. So if I go into the individual employee who I've assigned it to here, you'll see there's my COVID-19 officer training. Once the individual has done the training, presumably will be online, they can upload their cert. Okay, there's an expiry date, the training date of when it happened, who the actual provider was, does it require any CPD hours? And these aren't mandatory, but they're good for record keeping. So is there any CPD hours? So if they actually need to clock in hours, what was the delivery method? More than likely it will be online at this stage, but you know, some people are doing it face-to-face. Pillar, so it's probably going to be health and safety. And then the most important here is your cert. So whatever cert they get at the end of it, whether it's a certificate of attendance or anything like that, they'll upload a cert here. And then you'll have on record then basically the training that you've trained the COVID-19 officer, and you have it on file that this person has been trained. So the other types of training that a lot of our customers have been asking about, and you know what we've been kind of had a good conversation with the HR advisor Coach Lynch from ISME in regards to what training there is. So if you're if you're giving PPE to people, you know, that's not enough. It's really important that you give training around the actual the wearing of the PPE, the disposing of it, the keeping it clean, all that kind of stuff. So you have got to give training around it in regards to if you're any social distancing guidelines. So that's great. You put in a policy and procedure. Probably a good idea to do some training around what that social distancing is going to look like for you in the office. So there's probably going to be kind of a plethora of training that people can do in regards to online training before people come back to work. Now, we have discussed with some people, so I had a good discussion on one of the podcasts with one of our clients that they do a lot of the training themselves in regards to that they have, they use Moodle and they create training courses themselves that are specific to their own company. Or I'm sure you can engage with some online training company that if it meets your requirements, that you assign the training that way instead. Okay, or if you have an in-house trainer, but just make sure that you are assigning all this training to people. Great if it's all online and they can have all that training done before they return to work. Okay. And you will then have a constant, I'll just show you here, the report side of it. You will set CPD here in the reports. You'll be able to basically see who has done the training and who hasn't done the training. So that's very important as well, to be able to say, well, you know what, this training has been assigned to you and you actually cannot return to the workplace until you do this training. Okay. So we've signed all our documents, done all our pre-training before people are returning to work. Now, the other really important thing, it is under the return to work protocol, is that anybody who's returning to the office needs to fill out this COVID-19 questionnaire a minimum of 3 days before they return to work. So I've uploaded it here and assigned it to everybody. I'll just show you the document here. So again, we have all these templates, and you know, you can brand it yourselves, or you can say how you want it returned to you. But you know, the main things are have you got any symptoms? You know, have you had COVID-19? Are you in contact with somebody who's in COVID-19? Have you been advised to your doctor to self-isolate? Have you been advised by your doctor to commute at this time? And please provide details, basically, of any further illnesses that you may have. So are you basically in the high risk category? And we put a little link here basically for the list of high risk categories that are there. And in regards to, so everybody has got to fill this out a minimum of 3 days before they return to work. What I would say is at this stage, if you're getting these documents back and somebody obviously has put in that, yes, they're being advised to self-isolate, you know, absolutely you need to be having a discussion with an individual about that. And, you know, really, if they are in the high risk category, really important that you're having discussions with these people. One, to either alleviate their concerns that you've put in, you know, the correct maybe they're going to be in their own office by themselves, with their own bathroom, their own entrance, and something like that. But if you can't facilitate that you're able to continue to facilitate remote working for them. So really important to have that constant communication. I really can't stress that enough, because a lot of people who have those underlying health issues, they may be a little bit fearful at some stages of what will their return to work look like, and to make sure that you actually are engaging with these employees, and to communicate, that you're looking out for the best for them, and that's really important. So there's a couple of different ways that you can get this form kind of put out to people. I think the best way is you create it as a CPD document. You've just seen I've downloaded it there. So I have it here. I've assigned it to everybody here. They download the document, they fill it out, and then they can upload it here as well. Okay, and then once that comes in, so then you'll have a record basically of everybody who's filled out the questionnaire. And after that, very important that now you're discussing with people if there are any issues that people have had. Okay, so so that is that aspect. So now we've done all our work and people are ready to come back to work. You've had those discussions with people. You've looked at the office to see that you can no longer have 10 people in the office. You may only have 5 people. So you're going to maybe perhaps do a week on, a week off of working from home for people, or whatever you're deciding to do with people. And so you need to put in some kind of rota system in place of when people know that they'll be working from home. So the next step here then is the time off section. And this is where you can actually schedule people to be working in and out of the office. So I'm just going to show you here the Who's Off calendar. So in this calendar, so basically, you can see here quite visually, it's the working out of the office. That's that yellow color here. So I can see that Liz is going to be in this week, and Kelly's going to be in basically every second week. So that's what I've done for this calendar. And obviously, if you can visualize for the rest of these guys, you can do every second week as well. Whatever requirements it's going to be for your office. Whether you can now, you're going from a 10 people capacity to a 5 people capacity, or whatever it is that your risk assessment has given you those guidelines around. So you'll have to, and then, some people, it's important that you're working with them. So maybe they will want to work in the office in the morning time and maybe at home in the afternoon, and you maybe want to switch that around with people. So you can do that kind of in half days as well, or, really it's just important that it's whatever suits your company and your office settings. So if you see here the type of leave, so I've created a leave type here that's called working from home. Okay. And you can either, if you want to do maybe that they want to do all half days in the morning, you can do, maybe 2 or 3 weeks of half days that they'll be working from home, and in the evening they'll be working in the office, or every second week that they'll be working from home. Again, whatever way it's going to be working for you guys. And if you have a ton of these, please come and talk to us, and we'll figure out the best way to make sure that you're populating the Who's Off box properly, the Who's Off calendar, sorry, properly. Okay, so now you've rostered everybody when they're going to be in and out of the office, and you've relayed that they've signed all their policies and procedures. You've decided in regards to how many people are going to be in the office at any one stage. You've communicated that to your employee. They've done all their online training. Eventually, you're now ready for them to actually set foot the first day into the office. So it is a requirement that companies need to facilitate contact tracing. So you do need to record a contact log for people who are going to be in the office, your employees who will be in the office. So HRLocker can facilitate that for you, can help you. Can help you in regards to your contact logs for your employees. And the way to do this is if you have the clock in and out GPS turned on for people. So I'll just show that to you here. So you see here, we do have an app version. Totally confused. We have an app version, so people can just download the app onto their phone. We have a tablet version, so if you prefer to just have one location, it's actually a voice activated tablet, so people don't have to be touching it. So it's kind of a health and safety free zone. People don't have to be touching it with their hands, so you can have just a tablet that people can just talk to and clock in that way, or people can clock in and out on their laptops as well. So a number of different scenarios, but basically what the clock in and out does, it records your GPS location. So if people are clocking in and out when they come into the office, you will be able to download a report. I'm just going to show this to you here. Oh, not this one. Do I have it there? Of our location report here, where you'll be able to see basically list of employees per day and what location they were in. So unfortunately, if you're ever in the situation that there is a COVID case and you need to be able to go back and see, well, who has this person been in contact with? This will help you towards your contact tracing, in that you'll be able to see, okay, well, I can see who was in St. Patrick's Road here, who was in that office building at that day over those last 10 days. Who's this person? What days have people been in the same office here? So again, this GPS location it's part of the professional and premium packages. So for those people who are on those packages, we can turn it on and you can trial it and see how that works. And again, a number of different options. People can just, they can either download the app, or they can just log into the website on their phones, or you can have that actual download the app onto a tablet as well, and do it for everybody that way. Okay, so then, like we discussed there, people are clocking in and out, and that's working for you. You're able to track your employees in regards to who's in and out of the office. And then unfortunately, you might have that somebody has actually attracted COVID-19 and you have or they've been told to isolate or something like that. So the individual will come in here and they will record sick leave and say that it's COVID-19 related. So at this stage, very important that once this box has been ticked and somebody has actually registered that it's a COVID-19 related sickness, that you're following the correct policies and procedures that the HSE has laid out in regards to, notifying people, make sure that you have their contact logs in place, things like that. So, and that's really an ongoing basis. The other thing I actually didn't mention, is we have a number of downloads on our website that are for free in regards to templates and things like that. I'd also recommend that you go to the HSA website, and they have all the posters, and those yellow posters you see around the town at the moment, so that you have those kind of posted all over the office in regards to COVID-19 symptoms, social distancing, hand washing, all those kind of things, and they're all free. So you can go down and download them and make sure that the office is prepared with the notifications all over the place, basically, to make sure that people are staying aware, really, I suppose, is the key. So I suppose that the last two things I'm going to go through is, this is really if you are, you're bringing people back and they may have been remote working, for the last 3 months. But for those people who you've actually had on a COVID-19 payment, in regards to that, you've let them go for the last 3 months, and they're on short-term layoffs, they'll be here in the short-term layoff section. Quite easy to reactivate them back into the system. So all the people who have been on short-term layoff, let's say for the last 2 or 3 months, should be listed here, and you can just bring them back as when you're returning to work. So you'll go into the person, select their terms of employment, and basically activate them again. Okay, once you're activating them, there's a little note that says, if you're reactivating, please review their current job title. They're probably going to keep the same job title. Important thing here is that for the amount of time that they were on short-term layoffs, so maybe it was 2 or 3 months, they wouldn't be accruing leave during that time. So I would certainly say at this stage is that you need to be having a conversation with your employees. If they've booked 3 weeks holidays, for example, in October, and now they do not have that leave worked up, make sure you're having those discussions with your employees and work something out. I'd really recommend that. So, and this basically, once you reactivate them, this will keep a record of the short-term layoff. So if it was for 2 or 3 months, but there'll also be a record of their length of service as well. So, if somebody's been in the company for 10 years, you laid them off for 3 months, their length of service will also still be recorded. Okay. Okay, and then my very last thing before I start, this has gone on quite a while, so my very last thing really is I've done is when you're going to be bringing people back to work, and perhaps their work situation may have changed, and now you're bringing them back on a part-time environment. And this is unfortunately when you're going to be changing their work patterns. So I have done a number of webinars in regards to work patterns, and I'm happy to bring you through them again. We'll send them on to you again. But if you will be changing work pattern, you will be doing that here in the settings section. You'll have their work pattern already set up in the system. So their part-time work pattern, you'll have it set up in the system, and you'll change them to that new, whatever their new work pattern will be, whether it's going to be maybe one Monday, Wednesday, Friday, or half hours, whatever it is, and you can change them onto that work pattern, put in a, I'll just show you here now, what dates it's going to be relevant from. So, you know, maybe it's only going to be till Christmas. So you can put them on a part-time work pattern for 2 or 3 months, and then you can add another row basically when they're going to be back on a full-time pattern. So guys, I think I've gone through a lot there, and I see I have a lot of questions here, and so I'll just go through them here with you. And please, if you have any questions, shoot them off to the Q&A there, and Isabel will send them on to me. So a couple of questions I have here is, so do you have a sample COVID-19 response plan you could share? So we do. We have a sample, and it'll actually be going out with this at the end of this webinar. We will be sending out a copy of this webinar, as well as the sample documents that I've gone through. So how do you view the correspondence if you need to see it later? So at any stage, if you go into HR Docs here, so these documents are always here to see. So I think we had, was it Crystel we were using? Yeah. So you see here this communication. So if I click it, it downloads the document here. So you can always be able to view the correspondence. Then that's I suppose the beauty of using an online system like HRLocker, is that any communication will be always here. You know, so at any stage you don't have to go and look for it. It's here for you. Do you have any details on what the COVID-19 officer training entails? So what I would say is we do a lot of work with ISME, and we have a podcast going on with this as well. So I would steer you in their direction. They have a lot of great resources on their website. So have a look on their website and see what training they have available for the COVID-19 officer. I've also seen there's a number of skill nets that are also offering that training as well. So I definitely point you in those two directions. Another question, are there guidelines for what the COVID-19 officer role is? So again, we'll have a quick look here if I have anything at hand and I can send them out, but I would certainly, I have seen that a number of skill nets are doing a number of training sessions there, as well as ISME having a lot of things on their website there as well. Does HRLocker have any plans to introduce a specific contact tracing log facility to the platform? So at this stage, we will not be doing contact tracing in regards to if you have visitors coming in or anything like that. The main reason is that you're only supposed to be keeping it for 28 days. So we can facilitate in terms of the contact log for your employees, but we will not be doing contact tracing in regards to people coming on and off site who are not employees. And the main reason being is that there's a number of facilities who are doing it, and yeah, I definitely steer yourself in those directions. Okay, perfect. So guys, that's I hope you guys got a lot out of that. Again, please, if you have any questions at all, contact either myself in the office or Sinead in the office. We'll be delighted to go through anything with you. After this webinar, I will be sending out obviously a copy of the webinar, but also any of the documents that I've gone through as well. And I'd strongly suggest a couple of places to definitely look at is the HSA website for getting all your signage in place. Download as much as you can and put it around the office. You know, make sure that you're doing your risk assessment and putting in and really just following the back to work protocol that the government is setting. Start thinking about how you're going to be doing your contact log. So this is one way where you can get people to clock in and out. But then if you have, and that's absolutely fine in regards to if it's just employees who are going to be in the office, but if you're going to have other people inside the office, then then you'll need to put another facility in place in regards to monitoring if there's external people coming inside and in and out of the office, and make sure that you have all that training kind of sorted and ready and prepared before the return to work. And definitely I would strongly recommend make sure that you're constantly communicating with your employees, telling them what's going on, tell them what your plans are, tell them how you can help them. So thanks very much, everybody. And again, if anybody has any queries, please come and talk to us.